Hey, it's me. And if you live in New York, you've probably heard the buzz, or maybe you haven't, about a huge shakeup in health coverage. Let's cut right to it. This summer, state officials announced that New Yorkers will lose their Essential Plan health insurance. That's not a typo. Nearly 500,000 of our neighbors are about to be left searching for new coverage. Why? Well, it all comes down to money and politics. In July 2025, President Trump and a Republican-led Congress passed a bill slashing federal health funding. For New York, that means a $7.5 billion hit, just from one program. You might be thinking, can't the state just make up the difference? Turns out, it's not that simple. See, the Essential Plan, maybe you have it, maybe someone you know does, was designed for low-income folks. It's been a safety net since 2015, covering people who earn too much for Medicaid, but can't get insurance through work. The best part? No monthly premiums, just some small copays. Last year, New York actually expanded who could get this plan. If you made up to $39,000 a year as an individual, or $67,000 for a family of three, you could qualify. That helped a ton of people, especially lawfully present immigrants, who made up a big chunk of the enrollees. But with these federal cuts, the state says it has no choice. If New York tried to keep everyone covered, it'd cost taxpayers almost $3 billion a year. Instead, the state is rolling eligibility back to the old limits. That means if you joined under last year's expansion, you're out. So what happens if you're one of the 450,000 losing your plan? You can shop for a new one on the state's health exchange, aka the marketplace. But here's the catch. Those plans cost an average of $220 a month, and couples could see their rates jump even more. For a lot of folks, that's just not affordable. And it's not just about individuals losing coverage. Hospitals are bracing for a wave of uninsured patients, especially the ones already struggling to keep their doors open. We're talking billions in new costs for uncompensated care. That can ripple out to everyone, making the whole system shakier. Governor Hochul is furious. She's blaming Republicans in Washington for the cuts and calling on big employers to step up and offer real health benefits instead of skirting the law with part-time hours. But for now, 450,000 New Yorkers are caught in the middle. If you're affected, don't wait. Get help from a licensed insurance navigator. There may be options, but you have to act fast. And if you think this is unfair, now's the time to make some noise. Healthcare shouldn't flip on and off like a light switch. Stay informed, take care of yourself, and keep an eye on what's happening, because this story isn't over.